Second, okay, thanks.
Hello?
Hello.
Nice to see you.
Thank you.
Hey, done?
Looks like the weather brought everybody back out.
Healthcare brought everybody out.
We appreciate
That's
it.
right. We're on the 1 yard line.
Pablo got here early,
We're
I
not
seen him
gonna
out
punt.
there. I was
We're going on the touchdown.
Dean, Dean Kildee says, well, I got here 5 minutes out of that.
We seen you out there.
Yeah, I'll go
Appreciate
there.
it. Tiffany's gonna be giving you guys the update.
What happened?
I
wanted to talk to you.
I remember Mary called him, told him we want to see him now.
I walked out.
Anyone want to
Hang
sit?
around for a minute.
Yeah, well,
You're going to be so surprised. You want to sit?
I think so.
Yeah.
All right. See, just for you.
There were only two of them.
Come on in, man. Nice to see you again. Good to see you.
We ducked out before I got a chance to thank you for coming by.
Hey, Carol.
let's make it done. Hi, John. How are you? It's good to see you. How are you? Welcome to Flint. We're happy to have you up here. Yeah. This is a great crowd, my goodness.
We decided, we're in the
I
final.
feel like I need like a stand on.
Stand on the desk.
On your room.
So he's going to report how the
Want a chair? Do you need a chair?
how the old healthcare.
Put it right here.
Just go to your room, come on in.
Take me up the stairs.
Yeah, you went a lot of ways.
Michael? That's good. There's a man getting his health care right there. Michael? Keeler. He's right there. He's in charge. You're our ringleader. I'll give you back up.
Okay, is everybody in?
Nobody out!
Yeah, I said, is everybody in?
Nobody out!
Good morning! I feel like I need to stand on something.
Principal!
Hi, sweetheart. How are you? It's great to see such a large crowd. Last couple of weeks, we've had 8 or 10 people, so it's great to see so many people here. Welcome to our office. If you haven't been here before, we're here and open at any time, so feel free to come by anytime and say hello. I think that things are progressing.
Tell us who you are.
Oh, I'm sorry. I'm Tiffany Flynn. I'm Mr. Kildee's District Chief of
Thank
Staff. And I'm happy to be here with you guys. We are hearing next week, the 17th or the 18th, we may actually have a vote. Yeah, that would be a great St. Patrick's Day. Luck of the Irish or something, right? Because
Obama, right?
Because
For
we were
Obama.
having these discussions.
It's really Irish.
That's right. We've been having these discussions, it seems like, since last St. Patrick's Day. But that being said, Mr. Kildee has been reviewing the Senate language, specifically the Hyde portion, and I so apologize. The Hyde Amendment concerns that he has. As most of you know, Mr. Kildee spent some time in the seminary, and so the Hyde Amendment is very important to him, and he spent 34 years in Congress.
Excuse me, I have to interrupt you. Just because he
No.
went to seminary doesn't mean he automatically supports the Hyde Amendment. And my name is Reverend Dr. Deborah Kohler, and I do not support that amendment or that way of thinking. And there are many people of a religious bent who don't.
Your point is well taken. I simply was speaking, I was asked about Mr. Kildee's stand, so I was simply stating his stand.
Right.
But I appreciate your
Based on the fact
comment,
that
thank
He
you.
went to seminary as if everybody who goes to seminary would come out thinking the same thing.
I was simply stating his facts. But thank you, I appreciate it. So that being said, he is been reviewing the language and is feeling very strongly that he will support the health care. He feels that the Hyde Amendment is indeed what's the right word? Is maintained. The spirit of the Hyde Amendment is maintained in the Senate language, and so he intends to support it. So that is, things can change in Washington. We all know that, but that's the good news, is that we may get a vote next week. And I think that all of your efforts and all of your interest in all of this has been wonderful, and we can't tell you how much we appreciate the fact that you guys have stuck with this and stuck by this and continue to fight the good fight, and we appreciate that so very much.
So as far as our pension's concerned, being an activist, every time we come in since September 3rd, we punch the clock. When does our pension check start coming in?
Has anybody actually logged those hours? Because it would be curious to know how many hours you guys have spent on this, because there's certainly been a number, and there's some faces I see in this room who I've seen every Thursday since this discussion began, and it's wonderful to see new faces as well as some of those folks that we've become friends with over the last months and months talking about this. So.
Well, if you could do us a favor, Tiffany, just convey a message to the good congressman that there are a number of organizations here, the UAW, the Service Employees International Union, Miss You Can is here, and we all have members all over the state, and we just really want to thank Congressman Kildee for standing up for working people, because as you know, there's so many people that are suffering because of lack of health insurance, and so many small businesses, even large businesses, that in order to get back on their feet to create more jobs for Michigan, get the economy going, we really got to have health care reform. And we just want you to know that we're telling all of our friends and family members and contacts and activists, but what a wonderful man Dale Kildee is, a man of principle, and a man that cares about Democratic Party principles, and someone's going to be with working people, middle-class working people through thick and thin. So.
Push for the abortion.
Well, thank you very much. Thank you. I will say that that's what the reason why. I mean, growing up in a union family, one of the things that I love the most is that many of the labor organizations, a lot of the people who've been visiting us and putting in all that time have health care.
Right.
They're not doing it for themselves, and I think that's what makes it such a unique fight.
Right.
And that's what's wonderful about our labor organizations. They have brought this country to a place where things are safer, better working conditions, and all of that. Not just for their workers, but for many folks, other folks. And that's what's great about this.
Yeah.
About this is that they continue to do that on this fight too. Most of the people I think I've seen on Thursdays, every Thursday, are people who have health insurance.
Right.
So this is second. Yeah. So I think it's wonderful that they continue to fight the fight on behalf of those who aren't here. Did you have a? I was gonna say, I thought I felt something behind me.
Yeah, I have a question.
Oh, just tell me I can do here. Just yeah. So
I
I'm sorry.
have not a question, a request.
Just make the clarification, please.
And we all here, we talked to Dale, and we would like, and Dale knows that, the president's been going around the country pushing this. Would you invite him that we would like the president here?
Well, I can tell you, I don't know if anybody actually heard this on the audio on their TV, but at the State of the Union, if you hear if you actually slow it down and listen to what Dale says to Obama, when Obama shakes his hand,
Right,
he says, please come back to Flint soon. And he said to him, I will.
Yes.
So Dale, we just talked about this the other day, so Dale said I definitely need to follow up with that with a letter to him saying, when you shook my hand at the State of the Union, you said, I will, so now I'm asking you to do that. So we would love to have him come back
Congressman
to Flint.
Grayson out of Florida introduced a standalone amendment last night, which is basically Medicare for all as the public option. He had 35 co-sponsors as soon as he introduced it. We would encourage you to encourage Dale to sign on to that, because that would be the perfect public option for everybody.
I will pass that along. I can tell you that this morning, when the congressman came in, he went straight to a Democratic leaders meeting talking about the 17th and the 18th and all of that. So I will definitely let him know of your wonderful presence today and your suggestion of that. So I will definitely do that.
Any other questions?
Yes, ma'am.
Just a comment that not everyone, I'm very new to the whole procedure, but at any rate, I know many people that do not have health insurance that are working people, myself included.
Sure.
I'm the owner of a small business, and my daughter, luckily for me, I'm divorced, and my ex-husband has insurance for my daughter. Okay, so we work that out, but. Really, what we really need here, and this bill itself, from what I've seen of it, is not what we need. We need the Medicare for all. We need all people covered. And then I'm thinking that the competition, I know, of course, the insurance companies don't like this, and I know they have a lot of money, but you know what? The people are the ones who vote for Congressman Kildee, not the money from the insurance companies.
Well, and just so that Mr. Kildee does support a public option. This is sort of, we recognize that this is not the bill that we all thought or wanted.